As a result of Covid-19, one of the most difficult things to access is healthcare because of the lockdown. But the health professionals are also at risk because they are fighting at the front line. So what is the way forward? In this podcast, we're going to be looking at some of the technological advancements in the healthcare and how we can improve on the patient-doctor interaction.
Welcome to the New Vision Podcast.
New vision, covering the whole world.
Welcome to this podcast. Thank you for joining me. My name is Adi Fred Max. You can connect with me on Twitter. My Twitter handle is Adi_Max. That is ADI_MAX. With me today is Davis. Davis, you're most welcome to this podcast. Kindly introduce yourself and tell us exactly what you do.
Hi, thank you for inviting me to the New Vision podcast. I'm Davis Musinguzi, the Managing Director of Rocket Health, a service of the Medical Concierge Group. I'm personally trained as a medical doctor and also in IT and healthcare management. My role is to lead an organization that delivers telemedicine services. And the way that we do that is through a 24/7 medical call center where patients can interact with the doctor through chat, phone calls, and video. And if there is need for a prescription, we deliver that out of our pharmacy to your location. If we need to arrive at a final diagnosis, we can also pick up your lab samples, run the tests, and get back to you with the results. We also run an appointments-only clinic that also does vaccinations and other clinical procedures.
Thank you, Davis. Now, let's look at the impact this pandemic has had on the healthcare generally, but also looking at the patient-doctor interaction that seems to have changed recently.
The pandemic has had a huge impact on the healthcare sector globally. And this is mainly because healthcare workers at the front line are normally the first to identify these pandemics, and in most cases put themselves at risk during those first encounters. As it tends to spread, what happens is that it puts even more strain on the need for health workers within certain areas, within certain specialties. It puts a strain on the availability of finite resources within these hospitals, cities, and countries. It has totally stressed out the global supply chain for protective equipment and also vital items responsible for combating this pandemic. And more importantly, it has also put a strain on how people live their lives, because everybody has a role to play in making sure that we prevent the further transmission of this pandemic. So you could say that, at the front lines, health workers have seen tragedy, they've seen deaths. They are still being asked to put their lives on the line to make sure that we get ourselves out of it. But really, everybody has a role to play in making sure that we get through it.
Now, Davis, because of the shutdown, the truth is that the interaction between doctors and patients have changed. I'll ask you to share more on this because of your experience.
How doctors have had to interact with patients has also drastically changed. Previously, doctors would highly recommend that patients come into a hospital, a clinic, or some kind of physical location for them to get the triage that they need, the examination that they need, any kind of history taking, and use that as a base to deliver services through labs, through the pharmacy, through imaging, or any other interventions that should be done within a physical facility. However, the way these facilities had been designed was to have waiting rooms and to group people up to be seen one by the medical doctor. And what that does is it really does expose people to even more infections, especially if somebody is coming in with symptoms of Covid-19, but they're yet to be seen and you're sharing the same waiting room space. As a result of people staying home also, it has become impossible for people to go to these facilities. So the mobility restrictions that have been placed around major cities due to this pandemic means that people have to change the way they get their care, whether it's for acute conditions like infections, or whether it's for chronic conditions like diabetes and hypertension. So the doctor-patient relationship or service model is also getting revamped to make sure that it is suited for the safety of the patients.
Thank you, Davis. What possibilities are we seeing in the future as far as healthcare is concerned?
For the longest time, I have been an advocate for telemedicine. Even around the world, you have leading medical providers that had started to adapt to using telemedicine as a means of resolving healthcare challenges of their patients without crowding out the hospitals, without putting people at the risk of cross-infections within hospitals, without also the expense of traveling to the health facility and queuing up. It's an expense of money and time to go with it. So telemedicine has really played a vital role in making sure that people can continue to get the care that they need through chatting with doctors, through any kind of application that supports chat securely, through phone calls with their medical professionals where they can explain their symptoms, where they can get counseling, where they can get psychosocial support, where they can get routine follow-up for conditions that were already being seen. It's also possible to do video, and video is highly encouraged because then you can also see the patient and you can be able to get any kind of physical cues by looking at the patient. You also have a lot of what they call store and forward, where you can take a picture of a skin condition and forward that to your dermatologist to be able to make a diagnosis. So I think there's finally a lot of room for these technologies to fill in the gap that has been created by the pandemic in terms of access to healthcare.
Thank you, Davis. Now, because of this unprecedented time caused by COVID-19, there's need to be creative, but most importantly, adapt to technological advancement, especially in the medical field. Kindly share with our listeners, especially those in the medical field, drawing examples from Rocket Health.
What we have done at Rocket Health is to make it as simple as sending an SMS. If you send an SMS with the word CARE, C-A-R-E, to 8080, and follow the prompts, you get a call back from a medical doctor who will take your history, try to understand your symptoms, and if we have enough information, write your prescription and deliver that prescription out of our pharmacy to you at home or wherever it is that you may be. If we realize that you may need some lab tests, a technician will come to your location, pick your samples, we'll run those tests within our lab, and the doctors will call you back to explain the results. If we identify that you need a service from a specialist or at a different location, we will write you a referral and mention where best you could get that service during this COVID-19 pandemic period. What we have also done is make it easy for people online. If you just go to rockethealth.shop, you can be able to order any of the pharmacy items, lab items that you normally would need, but you can also schedule any kind of services, e.g. vaccinations at home and so on. We try to make it as simple as for everybody, whether you're on the internet or off the internet. If you just call our toll-free line 0800 100 700, it gives you access to different services that we can provide, and if we can't provide it, we'll refer you to somebody that can. There are lots of apps that have gotten into the market right now that are supporting this telemedicine delivery approach, and we recommend that a lot of doctors get in touch with some of these providers because they can sign themselves up to these services and start to manage their patients digitally.
Davis, thank you for sharing knowledge and time with us on the New Vision podcast. Any last word, especially for the medical professionals who are on the front line?
I want to appreciate all the medical professionals that are out there on the front line, making sure they get to their duty stations so that they can serve their patients. All the people that are involved with delivering medicines to acute or chronic care patients, all the lab technicians that are picking up samples for the Ministry of Health testing or for their private labs that are doing any testing for other conditions. I'd like to thank everybody that has been able to keep their health facility open. Please keep serving above self. I appreciate you. And if you want this pandemic to pass over, I'm asking everybody that's listening to this podcast, please stay at home. Please stay safe. Wash your hands at every opportunity that you get. Use sanitizer. And if you have any symptoms of COVID-19, please report these to the Ministry of Health immediately. If you have any dry cough, if you have any breathlessness, any difficulty breathing, if you're experiencing any fevers, please get in touch with the Ministry of Health so we make sure that you're safe and sound.
Thank you so much. We've been speaking to Davis Musinguzi, Managing Director, Rocket Health Services of the Medical Concierge Group. You can get in touch with me. My Twitter handle is adi_max. That is ADII_MAX. Thanks to the team I've been working with, Stephen Senkaba and Irene Besigiroha. You can find more podcasts when you go to www.newvision.co.ug. Remember to stay safe by maintaining social distance. God bless you. Bye-bye.
You've been listening to the New Vision Podcast.
New vision, new vision.